Good evening. It's 7 o'clock, and I'd like to call the meeting of the Cunningham Town Board to order. Would the clerk please call the roll?
Mr. Ammons.
Here.
Mr. Brown.
Here.
Mr. Jacobson.
Here.
Mr. Madigan.
Here.
Ms. Marlin.
Here.
Mr. Roberts.
Here.
Mr. Smythe. Mayor Pressing.
Here. Is there anyone who would like to address the Cunningham Town Board? Okay, I would like to make a little comment here. Tonight, our task is to approve the estimated levy for the town fund and the general assistance fund, and you will need to approve the final levy on December 14th. That's to meet the requirements of state law, that the timing. But I think from now on until December 14th, it would be helpful to consider the township needs for perhaps the next 5 years. In this context, we should review the proposed tax levy relative to the fund balance in each fund. And I've just looked at this roughly. I've set up some spreadsheets, so if it's not completely accurate, we'll get it refined. But at first glance, it looks like the town fund has a fund balance that's about $300,000 over the estimated spending. And the general assistance fund has a balance at about $1 million over estimated spending. So it may be possible to lower the total levy enough to lower the tax rate, maybe 3 to 5 cents. But we won't know this is possible until we have a good discussion with Michelle Mayall about the outlook for the next 5 years, how much of a fund balance is reasonable for each fund, and the impact of tax caps if we choose to reduce the levies. Anybody else want to make a comment? Okay.
Yes.
Okay, Mr. Ammons.
I don't know exactly when we would have this discussion with Michelle, but our job tonight is we approve the estimated levy. We could have this discussion between the next 21 days or whatever, and if we wanted to make a particular change, we could do so at the day where we finalize the levy. Is that your understanding also, Michelle?
First of all, it's not an estimated levy. It's not an estimated anything. We don't have the same rules as the city does. So the only way that we have to wait the 20 days is if we are going above the 5% for truth and taxation purposes. None of this is estimated. This is all presented as final, and it has been every year. The only time we have to wait the 20 days is if we're requesting more than 5% increase in the levy.
But we still could change it on the 14th, right?
If you don't approve it tonight, yes. But this is not an estimated anything.
Okay. Well, thank you for explaining that.
Sure.
You were
And
going by the same rules that the city has, but you have different rules.
Right.
Okay.
Also, the difference I want to point out between the resolution and the ordinance, the resolution is just stating that we're not asking for more than 5% increase. That is it. It has nothing to do with figures. It has nothing to do with splitting it out or anything. It is just saying we're not going over 5% raising the levy. So
Okay.
the resolution, there's no reason, I don't think, to hold off on it unless you plan on increasing the levy more than 5%.
Okay.
If not, that can be approved. Now, the ordinance is where, you know, everybody has their own opinions that can be discussed. But the resolution, I don't feel like it needs to wait unless somebody expects to raise the levy more than 5%.
Well, could we set the levy on the 14th? Or does it
The
have to-
ordinance for the levy, yeah.
Okay.
And discuss
can-
it tonight, so we all.
Well, we get, yeah, I think we're going to
mean-
have to have more than one night's discussion because, like, I was not aware of that difference in law.
Yeah.
So,
It's just if you have to comply with the truth and taxation law.
okay.
And we're not raising it, I would assume, so.
Because there's discussion about how much we should put in social services. There's discussion about what the changes to Obamacare will do to your general assistance fund.
Right,
And there's
which,
probably
I mean,
a lot of other things that you would like to explain.
Yeah, I mean, I don't know why there would need to be another meeting unless somebody wants more documentation. But, you know, we've had 2 weeks and I haven't heard from anybody, so, you know, it's,
What
I
about
can't
the fund
bring
balance?
everything.
What about the fund balances?
The fund balances, if you look at the budget that everybody approved in July, it has the estimated amount we started with, the cash we're going to receive, the expenditures, and what will be left at the end of the year.
Okay, because it
So-
seemed to me that if you took out the hospital spending, which I think you're going to do next year, right?
Right, we're going to put that in a separate account. I'm working with somebody at Busey right now to, you know, make sure we're not over FDIC and all that, that they insure only 250,000 per account, you know, and all that stuff. But so this is, you know, pretty close as far as estimated of what is being spent and what is being, you know, saved. But also, if the expenditures, if you take out the Carl money, which I have done, it's not in the budget because it was listed as an expense, then the estimated expenditures for this fiscal year are $1,466,929, and we only levy $1,303,358.
Okay,
So-
when I looked at it, it looks like there was a pretty big surplus in the general assistance fund of about
Right.
$1 million.
Right. We're allowed to keep around 2.5 times our expenditures in surplus.
So there's a limit in state law? 2.5
It's not
times?
specific in law, but
Okay.
Supreme Court and other courts have ruled on a, I don't know, targeted amount. I don't know the correct terminology, but I have had Fred look into it.
Okay.
And the general consensus is around 2.5 times your expenditures.
And so ours is about what?
Ours is about a little over 1 year.
Okay, because like I saw $1 million more than spending in the general assistance fund.
Right, and the expenditures are about 900,000, so, you know, give or take a little bit.
Okay. Anybody have any questions? Charlie?
Well, what I would suggest we do is that we pass the resolution tonight, we hold on to the ordinance for a week, and we throw out some ideas tonight and this was the kind of discussion I thought we were going to have a week ago about the ideas that we could throw out and start discussion with Michelle, rather than go individually one by one to her office. But this way we can, you know, get a whole list of potential ideas out there right now, and then in a week we can discuss them at our regular town.
We could meet.
Or well, it's actually we'll be meeting not the 30. We'll be meeting next on the
the 7th.
7th. Yeah,
December
so that would
7th.
December 7th.
So
So
we
we
could-
have 2 weeks.
Right.
Right. So that would give us a lot of time. So, you know, a couple of the ideas that I've had are that it'd be nice to lower the levy a little bit since we have a pretty good surplus, but we need to understand the numbers of what's there. It seems to me that the town fund should have a little bit more surplus, sort of to balance out the GA. We can't move as I understand, we can't move excess from the GA to the town fund. Is that correct, Michelle?
Correct.
Yeah. So if we want to balance those out a little bit, we need to move money. We need to spend down some of the surplus in GA and create a surplus in town fund by you know, rebalancing this. We could move 100,000 right now from, for example, from GA to the town fund in the levy, so that we start that process of shifting that balance a little bit. And again, but we need to understand what's an appropriate amount of money to have in surplus in GA versus town fund. And right now, it strikes me that the town fund doesn't have enough of a surplus, and GA has too much.
So would you comment on the changes to the Obamacare and how that would affect you?
If it goes away in 2017, then we will be paying our clients' medical again. Depending on the caseload, depends on, you know, how much you're going to spend and, you know, what illnesses our clients have. You know, we've had a client forever that has HIV, and their one medication, one pill, is $1,000 a month. So it just depends on who we have on at that specific time. Now, when, you know, the caseload, you know, was higher at 178 and there was $425,000 in the personal allowance line item to pay the clients, you know, there was over $200,000 in medical. The more clients you have, the more medical you're going to have. So it's all going to depend on when in the year we get it back. If it's early 2017, then that, you know, we're halfway through our fiscal year. So if it's, you know, later in mid 2017, then that'll be a whole fiscal year that we'll be looking at paying medical.
So what is going to disappear in Obamacare in 2017?
If it's not 90% federally funded, it goes away. And it's not gonna be. I would almost bet a paycheck on it. Yep, that's one of the
Eric?
stipulations when it was written.
Okay.
So I'm going to use the word reserves rather than surplus, because I think that is a little bit, that's how I understand what this money that's being held. And I'd like to ask, what are typical levels of reserve for townships around Illinois? Is there any, I'm sure it varies widely, but where do we stand
It
in the
varies
spectrum?
because you can't compare like the village of Mahomet to Cunningham Township. That township has roads and bridges and not coterminous, so I don't know as far as reserves or surplus with other townships. I don't know.
How about, for example, townships that are part of Decatur? That would be comparable. Other urban townships where presumably then the city would really be responsible for roads and streets. Is there a point of comparison?
I mean, I could look.
Yeah,
I mean, I've
okay.
never researched that, so I really have no idea.
I mean, I personally think that the amount of reserves that we're holding seems to me to be reasonable and prudent, given the fact that the tax caps really mean that the levy would be almost impossible to raise.
Correct.
Should there be some major additional calls on, I wanted to ask another question, and that is, have you seen any impact so far on your clients of the funding gap in social service agencies because of the state budget issues?
No, our caseload has not increased because of that. Our caseload will usually increase when the Affordable Care Act. We had people on that were eligible for $1, and they could care less about that dollar as long as they had the medical card. There are people that need that or want that more than the cash. So that will also, if that disappears, the Affordable Care Act, that will also cause our caseload to go up. How much? I cannot tell you that. I would say probably anywhere from 10 to 20 clients a month. There's people that are that dependent on the medical.
Is there any chance to have a conversation with the local clinics about picking up where, when Medicaid falls off, because they are committed to charitable care, and
Right.
that would be a really good opportunity that you might provide them, it seems to me.
In the past, they have agreed that when you talk about the last resort, Township has always been the payor of last resort. So we used to get into discussions with Carl and the community care program that they said they were, and we're like, no, we are, and we came to the understanding that we were. So anybody that goes to Carl, the hospital, the clinic, it would be continue to be written off as community care because of their income. If they're on our assistance, they're still only getting $245 a month. So if they have our medical card and they go to Carl, then that's going to be written off, but not Christie, not Francis Nelson, not local. There's some doctors that, our clients see as far as mental health that, will not get written off and that we would pay for. So, it's pretty much just Carl, and since, the clinic is now owned by whoever, however that works, but the clients that go to Carl would be written off. We would not have to pay their bills, but we still have to pay their prescriptions, and sometimes the prescriptions are 10 times more than the office visit. Yeah, diabetics, cancer people, they're waiting to get on Social Security. mean, it's a whole different realm of people.
Aaron?
So first, Michelle, if you could repeat, the surplus or reserves can be up to 2.5 the amount of what again?
Of the yearly expenditures.
Yearly expenditures. Is that for the just period? That how does that relate to the general assistance versus the town fund?
It's like the expenditures for the town fund, not including Carl, are 924,164. You can take that times 2.5.
Mhm.
That'd be a good number to base your surplus on.
Mhm. And so, just for sake of understanding, then the idea or the notion that if the Affordable Care Act is repealed or whatever, then that money comes out of the
General assistance.
okay. And what do you anticipate? Do you have any guesstimate or estimate if you had to pay? How much of that 1,013,000 would be used?
Well, if we keep, the money in the budget every year, then it's going to be there, and we wouldn't have to use the reserves unless we went over what we already had in the budget. So
Okay.
that is when we would dip into the surplus. So if we budgeted $100,000 in 2017 fiscal year for medical, and we ended up spending 130, then of course 30,000 would come out of the reserve. But as far as in my opinion, rebalancing the town fund and GA so they're more match each other with the reserves is not. I can't think of the word for it, but you've got to have money in GA. That is, we're mandated by the state to have that program. If there's not money in there and we get unexpected medical expenses, from clients, when we get that back, or we have an influx in the caseload, I'm going across the street to Busey and borrowing the money. So I think it's completely fair and understandable to have more money in the general assistance when that is where we are required by law to do that program.
So I would just I don't know if I think you're saying that with Charlie's issue about the about the balance, but is there a particular projected number from your standpoint of what it would cost if it's not 90% funded?
If we got the medical back, if
yes.
the Affordable Care Act disappeared,
Mhm.
depending on the caseload,
At your current caseload.
I would easily budget 100,000.
Okay.
We have a lot of people that are waiting to get on disability, and it takes 2 years minimum to even get a decision, and 99% of the people are denied first time around. So they appeal. Then you've got to wait 6, 9, 12 months to even get a hearing. So then you have your hearing and then the decision. If the decision's favorable, they're approved, they're off, township. But if they're not, they can appeal that. So it's a pretty rigorous and lengthy thing for our clients to be, trying to get on Social Security. So all that time, they're still on township, and we're still providing their medical unknown to what, ailment they have. If a doctor doesn't write in big red letters that they are disabled, they're going to have to go before an administrative law judge.
Okay.
I'd like to make a comment or two on the amount of surplus. There is no actual hard and fast rule. I'd say not even an actual guideline on how much. Now, if you were to look it up, you indeed will find reference to the guidelines and the rules on this. And here's how that came into existence. Case that reached the Illinois Supreme Court. In that particular case, the surplus of that particular unit of government was 2.84 times their average annual expenditure. Supreme Court said, that's too much. That's illegal. So some appellate courts said, oh, well, then anything under 2.84 is okay. Well, that's not at all what the Supreme Court said. later appellate court said, well, the Supreme Court never said 2.84 is the dividing line, just that in that particular case, that was way too much. One of the things that the higher courts have held, and they seem pretty clear on this, is that when you are evaluating a surplus, of course, if you have too high a surplus, then that's illegal. And there was a case in this county a few years ago against a number of units of local government, including Cunningham Township, claiming that they had illegal surpluses. Cunningham Township was one of the units of government that prevailed in that case, the court ruling that Cunningham Township surplus was proper. Some units of government, they were too high. As I was saying, later courts have said that there is no guideline. The Supreme Court never intended that to be a guideline. They merely found in that particular case that it was too high. But they have said that you have to consider this where you have more than one fund on a fund-by-fund basis. So if you're deciding how much is too much, you don't combine the surplus in each fund and evaluate that, because they're for totally different things. How much is appropriate depends on a number of things. Supreme Court says that proper conservative fiscal management requires that you maintain a surplus so that you can function. You're not spending this tax levy on this year's budget. That's for the next one. Doesn't matter what year numbers are on them. You're not going to have the money until then. So, you know, it's like anyone with his own personal expenses. You need some money in the bank to pay the bills as they come due, which doesn't necessarily match when your paycheck arrives. So you could have too high a surplus in one fund and not have too high a surplus in another fund. On the other end, talking about how much is enough, I think that's not a legal question. That's a question, pardon me, for the auditor. As I understand, Township's outside auditor has expressed the position that the Township's surpluses are at an appropriate amount. Of course, what happens next year may affect that. It may be more than you need, in which case you need to start spending it down. It may not be enough. There's not much you can do about that until you get to the next time you levy.
What does the city of Champaign do if they're required to provide this medical stuff? Because they're at a much lower tax rate, so how do they deal with that?
The Township of City
Yeah,
of Champaign,
right.
they have a totally different program than we do. They have transitional assistance. So transitional assistance is different from general assistance. Transitional assistance, is only for people that are deemed disabled. So if you have someone come in that is unemployed and can work and meets all of our requirements, we approve them and send them to a work site. If they were to go live in Champaign and go to the City of Champaign Township, fill out the same information, they would not be eligible there because they're able to work.
Okay, so ours is called general assistance and
Mhm.
theirs is called transitional assistance.
Correct.
So for the people that are on transitional assistance, are they, is that township required to cover their medical costs?
Well, right now they're covered under Affordable Care Act.
But if that goes away, then,
Correct.
okay.
They
Thank
would assume that.
Charlie?
Yeah, I've got a couple of scenarios here I'd like to keep working on, and I think we can fill in a lot of blanks between now and 2 weeks from now, or I hope we can. When Fred and Michelle, you both talk about averages in terms of what the surplus is that a moving average based on 3 years, the past 5 years? How does the court define average?
Well, the cases I've seen talk about it have made reference to both the current year and an average of the last 3 years. So
Okay, no, that's a good number to work from. Okay, and then Michelle, I understand from looking at the numbers in the budget and the levy, it looks like you're sort of predicating the expenses on about 45 people as caseload.
Correct.
Okay, and then something that another question here. I know we can't move from the GA to the town fund, but if we have a surplus in the town fund and we have a need in general assistance, we can spend town fund money
Yes.
that direction. Okay,
Correct.
yeah. So if we were to move like I've suggested, just 100,000 to beef up the town fund balance a little bit, which I think is a little low, just in my looking at it. I think it could be a little higher. I'd be more comfortable if it were a little higher. Then that would be reasonable. And then my last question, and this is something you could research the next couple of weeks, it's my understanding that we could temporarily lower the levy for 2 years and not suffer the consequences of tax cap. We would lose a little bit of inflation, a little bit of growth in there, but that we can, but 3 years out, we could jump back to where we currently are. And that was something I think Bill told me about. So
I don't know that that's an accurate way to look at it. You'd really have to have it in front of you and reading it and considering your situation, and we can get more information on that if you want. As you may be aware, there is a new tax cap bill pending. You may have read an article in the paper about Parkland wanting to raise its levy wherever it can so as to cushion themselves against the effect of this law if it's passed. Of course, I'd never guess on whether any particular bill would be passed until it's done. But I think that would create further restrictions. I think facing the possibility of that, it doesn't make sense to me. And I mean, I keep in mind nobody voted for me; they voted for all of you. But it would make sense to me to avoid lowering your levy from the viewpoint of what you can do in the future and what new statute we may have in a few months or whenever it gets to an end.
okay, so here's what I would sort of request for to have in a couple of weeks so we can finalize the levy would be some scenarios going forward. What our expenses are expected to be with and without the loss of the ACA coverage at what you think are historical numbers based on your very educated statement of if ACA goes away, we're going to see a rise in those numbers. So a couple of scenarios, what our needs are next 2, 3, 4, 5 years out, I think would be a really good exercise so we could really pin down what it is we need. And I think in the meantime, we'll have to go read the tea leaves and see if we are under a threat of a new tax cap type situation. Though I would think that given the township is already under tax caps, I was under the impression that was more a way to rein in cities that have home rule.
That will, as it's presently written, it would add some units of government to it.
Bill?
Yeah, I guess I'm not in favor of spending down the surplus we have so much as just not continuing to add $100,000 or $200,000 a year to it. So I know our tax rate has gone from like 18 cents 5 or 6 years ago up to 24 or something now. So I'd be in favor of trying to keep the tax rate more constant like we do at the city, maybe have a target of 21, 22 cents for that, at least in the short term. And I do think that tax caps, you can look back 3 years, or at least the first year after you lower it. So we would have a year to see what happens with ACA and then take that into consideration. I think for the current levy, you have $127,000 budgeted for medical care. And if there's no change in ACA, we wouldn't spend that much, right?
Correct.
Okay. So there's kind of an additional surplus built into the current levy. The other thing I wanted to bring up is since we have almost half of our social service funding coming out of Township now, I think we should, let's see, we're meeting as Township Board, so we should ask the City Council if they could allow Michelle to vote on our distributing the funds like the rest of us have a vote. I think we could probably do that without passing an ordinance or something. I don't know. We'd have to ask the City Council.
Yeah. Well, you should keep in mind for the township that the supervisor is the chief executive officer, and these are all supposed to be her decisions, though you do have the authority the final authority on the budget and on the levy. I think you ought to keep in mind that she is not just a voice in the corner, but you should be paying a lot of attention to what she has to say, and she's been involved in this for a long time.
Eric?
I would just comment on the query that Bill was sending to the town board since the mayor votes on these allocations. I certainly think that it would be appropriate for the supervisor also to vote. But I wanted to ask another question. Does a unit of government such as we are that is assuming responsibility for healthcare expenses of some of its citizens, does such a unit of government ever negotiate an insurance policy? Is that ever done? And the reason I'm asking is that, of course, that's a way of spreading risk, because a small entity such as a township might have some catastrophe that really increased the healthcare costs dramatically, but would only be a small blip for a big insurance company.
How we pay now is we pay at the current public aid rate. So, for instance, an office visit, we would be billed $186. I'm sure it's gone up in the last 2 years, and we would pay $23.85. So that was the public aid rate then, or $26.35, somewhere around there. So we already pay at the lowest rate that there is. There is catastrophic insurance that I know the city of Champaign Township has, and in my opinion, is a waste of about $4,000 a year, because that's about what it cost, $3,500, $4,000, somewhere around there. With a caseload of 40 to 50, it's not needed. I wouldn't get it unless we were, really down in the dumps on our surplus. But, I think that there's more that is unforeseen in general assistance than there is in town fund. In town fund, the budget's more cut and dry. You've got the supervisor's side, which is my side, and you have the assessor's side. And so that rarely changes from year to year, except for increases, or we might have more training, salary increases, health insurance goes up, those kind of things. In GA, there's too much unforeseen. That's why there's more of a surplus in GA than there is in town fund. So, I don't, agree with the whole balancing them out, regardless of if you can take money out of town fund and put it into GA. If it's not needed, I think it's more fiscally responsible to leave it where it is and continue doing, what we're doing, just not, build up, more of a surplus than we're allowed to. But there's too much unforeseen with GA, big layoffs, you never know.
So if I could just pursue that just a little bit more. So roughly, what is the percent variation that we see in the load on GA from year to year? Can it be plus or minus 20%, 30%?
Well, when you have factors in there as far as the Affordable Care Act,
Yeah.
You know, I mean, I can't, off the top of my head, I cannot give you percentages.
But it's more variable than the expenditures that are
Right.
on the township fund. Okay.
Does Carl charge a facility fee for us?
If they do, we don't pay it.
We just don't pay it, okay. Dennis?
And our discussion about the budget is also based on like our current caseload. And wouldn't you assume that the caseload may rise in the future? We don't have really very stable economic times right now.
Correct. And it will definitely rise if the Affordable Care Act goes away.
Right.
That's a guarantee.
So it would seem really wise to have more money in the general assistance fund because one would expect that that would be an increase right there.
Right. I mean, March will be my 20 years there. I've seen a lot of people come into the township that could care less about the check. They need the medical because they are so sick, and the wait that they have to go through before they can even get approved or get to see an administrative law judge to actually put his eyes on that person to say, oh my God, you know, they really are sick and, you know, really need to be on Social Security, and then they have more income from Social Security. You know, I mean, there's more people that need the medical than not more. I shouldn't say that. That's not true. But it will definitely increase our caseload.
And it seems like the people who really need it are desperately needing it.
Yes. Yeah.
Yeah. And when you find that medicines are so expensive, I've been stopped at the airport by a woman seeking donations because she can't pay her medical for her prescriptions.
Right.
That's pretty serious situation here in America.
It is. And we try, and since we don't have it anymore, if someone was to call and it was a medication that was not covered under the Affordable Care Act, but it is something that would normally have been covered under our medical card, we'll pay it. So we do have to pick up the slack, which is very minimal, but there is some still there, but not, you know, tons of money. But, you know, we also try and refer people to the pharmaceutical companies themselves, because sometimes they will give free medications to those less fortunate that can't afford it. And if it's not covered, you know, if it's not covered, they just have to do without. And
Right. And you can't always survive just using honey and lemonade in your tea.
True.
Okay.
Okay, anyone else? Well, we are at ordinance number T 2015-11-003, and this is the ordinance levying taxes for all town purposes for the town of Cunningham, Champaign County for the tax year 2015, collectible in 2016.
That's the one I'd like to move to our meeting 2 weeks from now.
Okay, you're making a motion?
Yep.
Is there a second?
Second.
Okay, motion by Smythe, seconded by Ammons. Any discussion? All those in favor, please signify
Have
by...
discussion.
Okay, sorry, I didn't see you.
Hope
Go ahead,
this doesn't
Aaron.
open
Go
up a
ahead.
whole can of worms, but I wanted to make sure I was clear that this is not a estimate. So since we're not taking any action tonight, then whatever we do on the 14th or the 7th, is it the 14th?
The
7th.
14th. Well, the
Well-
14th is the deadline. Is that the deadline for the township, or just...
no, we don't have the 20-day grace period.
Well,
you can approve it
we just need
at-
to get it because we need to get it to the county clerk.
Well, I'd like to have it finalized at the December 7th meeting, quite honestly.
Yeah, I
Okay.
think we can do that.
Okay,
So at the December 7th meeting, we would take all these other things into consideration and vote on the actual ordinance of the tax levy then, right?
yeah, make sure everybody's questions are answered. If
Okay.
they have any questions between now and then.
All right, I'm clear then.
Any
Thank
other comments? Okay, all those in favor, please signify
Yeah.
by saying aye.
you. Aye.
Those opposed?
No.
Okay. That motion carries. Then we have resolution number T 2015-11-005R, a resolution determining the amounts of money necessary to be raised by the tax levy for the tax year 2015, collectible in 2016.
So moved.
Second.
Okay, motion by Marlin, seconded by Roberts. Any discussion?
So
Aaron.
Michelle, you're saying that the resolution itself does not specify an amount, so we can pass it and it doesn't,
Correct.
as long as it's not over the 5%.
5%.
Okay.
Then if it's over the 5%, then you have to deal with the truth in taxation law, and then you have to post it, and then you have the grace period that Laurel's referring to. So,
Okay.
but I do have one comment that
Okay, go ahead.
it's been brought up before about when money is received by the township, and that we get some before the end of the fiscal year. The reason being is when tax bills are prepared and sent out, they're prepared in May with your first installment due June 1st. Some people pay ahead of time, some people pay on time, some people wait until the last minute or their name's posted in the paper. So the people that pay early or the people that pay on time, we're gonna get money before July 1st because the county is required to send out disbursements every 30 days. So that money that we get in May and June is still not until use for the next fiscal year. So when everybody sees that, you know, we got a $200,000 check in May or June, we did because people paid their property taxes, but that's still for the next fiscal year.
Do they count it as the June 30th balance?
The county doesn't count it in.
No, when your audit is done, is it counted?
Right, it has to be counted because it's there, but it's allocated for the next fiscal year.
Okay.
So it's really not supposed to be used until that July 1st date hits for that
Okay.
fiscal year.
All right, we have a motion by Marlin, seconded by Roberts. Any more discussion, Charlie?
Yeah, Michelle, thank you. That reminded me of my last question. I'm looking at the audit now and the numbers that we have on page 6, which show the balances the fund balances at the end. Is there does it say in here anywhere where so need to look at that. That's not the true reserves, then those numbers represent the reserves plus this May and June payment, correct?
I don't know because I don't know what you're looking at.
Oh, page 6 of the audit.
I didn't bring the audit
okay.
with me.
Okay, yeah, so if you'd look at page 6 of the audit, it'd be
Okay.
good if you could give me the numbers
Okay.
for May and June that you consider to be the numbers that are the new tax payment for the coming year that really aren't part of the reserve. Because I think our reserves are
This would probably have any May and June that was received
right.
in
Yeah.
there.
See, so this reserve, this fund balance in the bottom of the audit is
Correct.
really an inflated
Elevated.
reserve number.
Mhm.
So we don't have the real number there. We should know
Right.
what our real reserves are.
Okay,
Yeah. Thank you.
sure.
Anyone else? All those in favor, please signify by saying aye.
Aye.
Those opposed? That motion carries. Under new business, we have resolution number T 2015-11-006R, a resolution authorizing the request to intervene in formal hearing with the Illinois Property Tax Appeal Board. This is the assessor. Dan Stebbins, any questions for Dan? Sounds like you should appeal, right?
Yeah, basically what it is just to fairly distribute the tax burden amongst all the taxpayers in the township.
Could you speak into the microphone?
Sorry. It's mainly I just wanted to intervene to ensure a fair and equitable tax assessment on all parcels. The one in question was requesting a reduction of more than $1 million in assessed value. And based on the current PTAB decisions I've seen, they're not likely to win the case, but I just want to make sure that we're invested in the case.
Okay, thank you. Any questions? Mike?
What property is that?
It's the Stone Creek Golf Course. Basically, they feel they should have an open space assessment on all their buildings, including the rental buildings that they have on the parcel.
Well,
Okay, Mike?
I can actually appreciate their efforts. based on the economy we have here. If they'd have a whole lot more rooftops out there, they probably wouldn't have to do this. But I think we ought to at least, if not as a matter of policy, we certainly ought to at least empathize with their situation because we've helped to create it.
Eric?
I'm perhaps not aware of what you're talking about. How did we help to create
Okay, let me flesh it out. We have a really high property tax rate here in Urbana, 25% higher than Champaign. So I think there'd be a lot more rooftops out there if people didn't look at the property tax rate and think, wow, I'll build in Champaign instead of Urbana. And if there were a lot more rooftops in Stone Creek, they wouldn't have to ask for relief from property tax like they're doing right now. Because they'd sell a whole lot more lots and they'd have a little better cash flow.
Okay, is there a motion to approve?
I move that we approve the pursuit of this case.
Second.
Okay, motion by Jacobson, seconded by Ammons. Any discussion? Diane?
Can you just clarify again what this action is committing us to, or the township to?
To be able to participate in the property tax appeal board's hearings.
To testify, for example?
Correct.
To appear as witness. Okay.
Right.
So,
Eric?
so what, I realize that, you know, you're not, there's some preparation to do for this, and what you say now might not be definitive, but what would be sort of the line of your argument in the appeal? What would be the basis for the for taking the position that the assessment should not be reduced?
It'd be a contention of law, and Fred would write an argument for the township. There's a case that was just heard in front of the property tax appeal board less than 6 months ago that agreed with our position that open space assessments will go to the ground of the golf course, but not to any commercial use of buildings. And that's basically what their attorney was trying to get, was their commercial use to be exempted, or
I can give
preferential
you
assessment.
I'm sorry, I didn't. I can give you sort of a summary of how this works. Land that's used for maintained as open space, just so there's open space out there, gets a special assessment, and in particular, buildings get a zero assessment. The land is valued and the building is valued separately, and then you combine them. The appellate court has held that buildings that are, I suppose you could say, accessory to or facilitate the open space get the same treatment, which means the buildings are assessed at zero. A golf course is considered open space. It's not a question of whether it makes money or not. It gets an open space assessment. Court has held that a building such as a garage that houses the equipment to take care of the grass facilitates the open space use, gets open space assessment, which means no assessment on the building. If they're running a restaurant that has no particular relation to the golf course, except after playing golf, people want to stop for lunch or dinner, it's a profit-making business, that would not be entitled to open space assessment. Every possible kind of building you might find on or around a golf course, it's not always clear. I gave you the two obvious examples. There are ones in between. So it becomes a question of whether the primary use of the building facilitates the open space operation. If it's an incidental benefit, that's not good enough. So these are the kinds of issues. There's no dispute, to my knowledge, over what buildings are there and what they're used for, but how they should be treated for the purpose of assessment.
And so, for example, are they requesting that the restaurant be, become tax exempt?
I don't recall exactly which buildings. I read this some time ago. I don't recall which buildings.
It would be the clubhouse as well as the catering business adjacent to it is what they're requesting. We've already, for 2014, we did remove the shed that houses the equipment, and we made that a zero assessment, trying to be fair and equitable with them following the law. And so we had a stipulation agreement for 2014 with them on that one, and they came back again this year, trying again for the rest of the buildings.
If that gets lowered, that would raise the tax rate on everybody else, correct?
Correct.
Okay. Any
Go-
other questions?
Yep. Go
We
get
have-
them.
We have a motion by Jacobson, seconded by Ammons. All those in favor, please signify by saying aye.
Aye.
Those opposed? That motion carries. Is there any other business? Well, since we don't have any business further, let's adjourn the meeting. Thank you all very much.